The job description of an emergency medical technician, EMT, involves providing essential pre-hospital care and basic life support to individuals experiencing medical emergencies. EMTs are crucial healthcare professionals who respond rapidly to emergency calls, assess patient conditions, and administer immediate care to stabilize patients before they reach advanced medical facilities. Their role forms the backbone of emergency medical services, ensuring timely and effective response that can save lives and reduce the severity of injuries. EMTs often work as part of ambulance crews, alongside paramedics and other first responders. Their duties extend across a variety of environments such as accident scenes, homes, workplaces, and public areas. The role demands a balance of medical knowledge, physical stamina, quick thinking, and effective communication to handle stressful and unpredictable situations. Primary responsibilities of an EMT. The foremost responsibility of an EMT is to respond promptly to emergency calls. Upon arrival at the scene, EMTs conduct a rapid but thorough assessment of the patient's condition. This includes checking vital signs like pulse, breathing rate, and level of consciousness, and identifying life-threatening problems such as airway obstruction, severe bleeding, or cardiac arrest. Providing basic life support, BLS, is a central duty. EMTs are trained to perform cardiopulmonary resuscitation, CPR, control bleeding, immobilize fractures, and assist with childbirth. They administer oxygen therapy, use automated external defibrillators, AEDs, and manage airways using basic equipment such as oral or nasal airways. EMTs are responsible for safely transporting patients to hospitals or medical facilities. They ensure patients are securely placed on stretchers and continuously monitor their condition during transit. Clear and accurate communication with hospital staff is essential to prepare the receiving team for immediate care. Documentation and reporting form a critical part of the EMT's job description. EMTs must maintain detailed records of patient information, treatments provided, and any changes observed during care. This documentation supports continuity of care and legal accountability. In addition to emergency response, EMTs may engage in public education about health and safety, participate in disaster response drills, and assist in community health initiatives. These activities help promote awareness and preparedness, essential skills and qualities for the role. EMTs require a strong foundation in medical knowledge relevant to emergency care, including anatomy, physiology, and first aid techniques. Mastery of basic life support procedures is fundamental. Quick decision-making and critical thinking skills are indispensable in emergency settings where EMTs must evaluate rapidly changing patient conditions and choose appropriate interventions. The ability to remain calm and focused under pressure can directly impact patient outcomes. Communication skills are vital. EMTs interact with patients, family members, emergency personnel, and healthcare providers. They must convey information clearly, provide reassurance, and gather accurate health histories even in chaotic environments. Physical fitness is essential due to the physical demands of lifting and carrying patients, operating equipment, and working long hours on their feet. EMTs often face challenging environments, including adverse weather, confined spaces, and hazardous scenes. Empathy and emotional resilience help EMTs provide compassionate care while managing the psychological stress of emergencies. Maintaining professional boundaries and self-care strategies are important for long-term well-being. Attention to detail ensures the correct application of protocols, medication administration where authorized, and accurate documentation. Safety awareness protects EMTs and patients alike from injury or infection. Work, environment, and challenges. EMTs operate in fast-paced and unpredictable settings. They may respond to a broad range of emergencies, including traffic accidents, heart attacks, strokes, respiratory distress, trauma, and medical conditions such as diabetic emergencies or seizures. The work often involves exposure to hazardous materials, infectious diseases, and emotionally charged situations. EMTs must adhere strictly to safety guidelines and use personal protective equipment to minimize risks. Shifts are typically long and irregular, covering nights, weekends, and holidays. EMTs must be prepared for physically and emotionally demanding work, frequently involving heavy lifting and exposure to distressing scenes. Teamwork is fundamental as EMTs collaborate closely with paramedics, firefighters, police, and hospital staff to ensure efficient and coordinated patient care. Good interpersonal relationships within the team enhance operational effectiveness. Despite the challenges, many EMTs find their career fulfilling due to the immediate impact they have on patients' lives. The role offers a unique blend of healthcare and public service, providing personal satisfaction and community respect, training, qualifications, and career advancement. The job description of an EMT requires completion of a state-approved training program, which typically lasts several months and combines classroom instruction with practical skills training. Coursework includes anatomy, physiology, medical terminology, trauma care, and emergency response techniques. Certification is mandatory and usually involves passing a national or state licensing exam. EMTs must renew certification periodically through continuing education and skills testing to stay current with evolving medical standards. EMTs may choose to specialize or advance their careers by becoming paramedics who provide more advanced medical care. Additional training and education are required for this progression, including in-depth knowledge of pharmacology, cardiac monitoring, and invasive procedures. Career advancement can also lead to roles in EMS administration, education, public safety coordination, or other healthcare professions. Some EMTs transition into nursing, respiratory therapy, or physician assistant programs to expand their scope of practice. Conclusion: the job description of an EMT defines a vital healthcare role focused on providing immediate, life-saving care in emergency situations. EMTs serve as the first line of defense in the medical system, offering essential assessment, treatment, and transport services that bridge the gap between incident scenes and hospital care. This career demands a combination of technical skills, physical endurance, emotional strength, and compassionate communication. For individuals passionate about helping others, thriving under pressure, and making a tangible difference, the EMT profession offers a rewarding and dynamic career path. With ongoing training and experience, EMTs contribute significantly to the health and safety of their communities, embodying professionalism, dedication, and rapid response in times of crisis.